Let's start with sort of basic hair care, washing, conditioning. I know this is so important when you have ethnic hair, and it's so dramatically different to the way that I might take care of my hair, which is wash and blow dry every day and like run a little conditioner through the ends. It's a totally different process, and it's a time consuming process.
Yes. So basically, the wonderful thing about coily, kinky, curly, textured hair is that there are so many different ways to style. So it's very hard to make generalizations, but I'll give basic categories of how women might style their hair. So first of all, as we know, their natural hairs are keeping the natural hair's texture is very, very popular right now. So someone with natural hair who doesn't have any chemical in their hair whatsoever may wash their hair every 1 to 2 weeks, may use a lot of conditioners and oils to help manage the hair because the hair could feel very dry. That remember, in straight hair, the oils that are produced from our scalp naturally kind of travel along that hair follicle down, and so the hair can get oily very quickly. The reason why women with textured hair don't need to wash their hair as frequently is because their hair never really feels oily. I never understood the concept of oily hair. I had to learn that concept because my hair was always dry. Like if I didn't wash my hair for weeks, it didn't matter. It was always dry. So a lot of women with textured hair add oil to the hair, add conditioning products to the hair to improve manageability and to improve like even brushing, the ability to brush the hair when the hair, if your hair is curly and you brush your hair. So, and certain hair types you don't, like afros, for example, after you style it, you don't brush it because then it would just, lose its shape.
Right.
So for people who have no chemical in their hair, the typical hair care practice would be to wash every 1 to 2 weeks and to use oils or conditioners or leave-in conditioners to improve manageability of the hair. And then that hairstyle could also be braided. It could, if the person wanted to maybe add extensions, they might braid the hair and sew in extensions. They might braid the hair and glue in extensions. That one I don't like, no glue at all, because glue is a common cause of contact dermatitis because some of the hair glues either have acrylates or they have rubber or they have latex. And so they tend to cause allergies in a lot of our patients. So glue is a no-no. And then there's braided in extensions or cornrowing. So that is for people who have natural hair. Then there are many different processes used to straighten the hair. So there's chemical relaxers, that's sodium hydroxide or lye. That works by breaking the disulfide bonds. And then that type of person, if their hair is chemically straightened, might do a wash and blow dry every 1 to 2 weeks, or a wash and set where they put their hair in rollers and sit under the dryer, because the goal for that person is to have straight hair. And then, and the different types of chemical relaxers to straighten the hair are, like I said, sodium hydroxide, but also keratin, which is very popular for people with coily hair because they report that their hair looks smoother and there's less frizz. Most keratin products, though, have formaldehyde, and formaldehyde is a carcinogen and is very much regulated by the FDA. So you've probably heard that term Brazilian blowout. That was a popular hair straightening process that women were doing that used high percentages of formaldehyde to straighten the hair